Thank you so much. So I think I don't know many of you. I think maybe I recognize one name. My name is Dr. Ann Loeffler. I'm a pediatric infectious disease doctor by training, and I've been the Multnomah County Public Health Department Deputy Health Officer part-time since April and August full-time. It's always been one of my career interests is school health. And in fact, I don't know if I mentioned it, if some of you heard me say this before, but I worked at Randall Children's Hospital for many years, and we put together a back to school program conference every fall for educators. And I think I missed maybe one they didn't ask me to speak at. So I do love school health. So Derek, if you could pull up my presentation, I think maybe yesterday morning, I got some little requests for things you all might like to hear about. So I put together some slides, and I unfortunately have a problem that I could literally talk all day. Let's go with I love to teach. Maybe I just love to talk. But you'll see things in here that I'm not going to really spend any time on. So my thought is that Derek would share these slides, and many of some of the things that are articles you can Google yourself, or you could email me and I can send you more information. But this is a little potpourri of things that I think sort of everyone would like to know about school reopening. Maybe they didn't know that they wanted to know about it. And then some of the things that Derek shared with me in particular. Yeah, go ahead and please share them publicly, no problem. I've worked in education, adult education, really my whole career, and consider my work to be public domain. All right, so the first thing that I thought I would just introduce to you is the topic of why did we close the schools last year, about a year ago? Because, you know, clearly many people know and have come to recognize that children have not been a big driver of this pandemic. Well, we didn't know that a year ago, because there's so many other infections, and influenza in particular, that are hugely driven by pediatric cases. So for example, in influenza, children 5 to 14 years of age account for 40% of influenza cases. You know, they're only about 15% of our population, but 40% of influenza cases. We learned maybe 10, 15 years ago that if we vaccinate aggressively the youngest kids, the elderly would not die. So why is that? Well, for one thing, the little kids don't have the herd immunity that many people have. Like, for example, for influenza, people who have gotten flu shots over the years, they may not be terribly immune to one particular new flu strain, but they have a bit of protection where little kids do not. And then the other feature that's very important, if you think about especially smaller kids, you think about the quote unquote higher intensity of their social contact. I like to think of them as being not particularly discreet with their secretions, cesspools, some people call them. I love children, needless to say, I'm a pediatrician. So you can understand that when we encountered this new coronavirus, we really didn't know what to expect. And the fear was that children and schools in particular could drive a lot of the transmission. Next slide, please. And in addition, throughout the history of public health interventions, we have used school closures, and even sometimes in the middle of a school year, a closure of a school for a few weeks can totally knock down an outbreak. For example, chickenpox or measles, back before those were not vaccinated again. So this is a well-known tool in the toolbox. We call these interventions non-pharmacologic interventions. So when SARS-CoV-2 came, of course, the Chinese were starting to share data, but we really didn't understand what the incubation period was going to be. We didn't know how contagious it would be, that number that we call the R0, or reproduction number. We didn't know what the spectrum of illness would be, so what ages of patients, or whether people would have asymptomatic infection, or when they would transmit the virus. If we do everything we know now, honestly, we probably wouldn't have shut down schools, because we could have understood how to keep people safe. So it was not the wrong thing to do. Those people who, you know, complain and say we never should have closed down schools, schools are essential. We did what we had to do at that time, anticipating that we could be in a heap of hurt if schools were a big problem. Next slide, please. So what we know now is that children are less likely, not absent, but less likely to be infected with the SARS-CoV-2 virus. They're less likely to be very sick when they're infected, with, of course, one key exception, and that's this phenomenon called MIS-C, or multi-system inflammatory syndrome with children, and they are less likely to transmit the virus to others. Lo and behold, who knew it, but kids actually can tolerate masks. They can participate in other mitigation efforts leading to successful control, and they can attend school and daycare with careful mitigation and not contribute significantly to ongoing spread within the community. Those have all been good things that we've learned over the last 6 months or so. Next slide, please. So around the world, there definitely have been countries that literally never shut down their school systems. And then within the United States, there have been states and there have been school districts that reopened early, either entirely in person in some rare cases, or mostly using a hybrid model where families could choose whether their kids were going to go back in school, and other children and families were offered virtual learning. The schools that came before us learned a ton, and every single one of them had bumps in the road. They spent a lot of money. People stayed up late problem solving, and they made adjustments to protect students, staff, family, and community. There have been very rare school closures because of in-school transmission. More often, when schools have closed, it's because of political pressure, especially during surge of community transmission. But there's no evidence that schools or school transmission exacerbate what is going on in the community in terms of transmission. Next slide, please. The next handful of slides are just some papers, and some of you may well know about this data. This is one of the first studies that was published, and it came from the North Carolina Collaborative. So 56 school districts, 3 prestigious universities, Duke and UNC, and many local public health authorities have collaborated in what they call the ABC Science Network to basically, they started out just being curious together. And they started out learning what they could learn from schools, from transmission, from pediatric disease. And over the course of time, all of these school districts at least did some in-person learning and learned and now have published the data. So I'm not going to spend a lot of time on this because it's not really what I was asked to talk about tonight, but I just wanted you to have available if you're interested and you don't already know this data. Next slide, please. Yeah, there we go. So this website I find to be totally amazing, and this group, this is the same group that published that paper. Just lots of amazing data and transparency that they share with everyone. Next slide, please. This is a study on child and teacher morbidity in Sweden. Sweden's another place where they never close their schools. They do have higher rates that many of you have heard about Sweden, and the way their health minister chose to address it, they made masking. At first, they didn't even encourage people, and then they sort of encouraged people, but they didn't make them do it. And they had case rates about twice what we had in Oregon. And but even though they didn't close the schools, they did not have any pediatric deaths. And they had, I don't know if you can see the bottom of the slide, but you can see that of professions that had public-facing encounters during the pandemic, teachers actually stayed healthier. Next slide, please. I think the next slide is about Norway, and I think that when some people are concerned about school transmission, they feel like aggressive contact tracing hasn't been consistently done. So when kids get COVID and someone says, oh, but they didn't get it in school, this was a study that aggressively did contact tracing of the children in the areas, the 2 counties where they had the highest coronavirus spread. And what they found is only 2 primary cases. They tested 234 child contacts and found very, very little transmission within the schools. So very encouraging data. Next slide, please. This is a little study from Mississippi where researchers called families whose kids had positive tests for coronavirus, and they called families whose kids had negative tests. Next slide. What they found is that in-person education did not predict increased likelihood to have a positive test. So schools were not the driver of positive tests. It was parties, play dates, weddings, funerals, and I apologize, I can't see the last one. But the data was very, very encouraging in a state where mask wearing was not terribly prevalent. Next slide, please. And then the American Academy of Pediatrics, just after the first of the year, put out extensive guidance, extensive resources, a collection of the literature so that we could all benefit from it. And I don't know if you can see the bottom of the slide, I can't see it, but it says something like, schools reflect but do not contribute to community transmission. Next slide, please. These are the tenets that American Academy suggests for how to use mitigation factors in the schools. Next slide, please. And these are their advice for elementary schools and high schools. I'll let you read those at a different time if this is something you're interested in. Then next slide, please. I'm afraid you won't be able to see the bottom of the slide, but Derek, I don't know if you can just pull this slide up a little bit because the important bit's at the bottom. You may all know that adults in the schools, remember I told you children, especially young children, middle schoolers, teenagers, high schoolers, they can transmit quite effectively the virus, but little kids do not effectively transmit the virus, but adults can. So in most school studies, it's been staff who have brought in the virus and staff who shared the virus. So the advice to the adults is much more stringent than that to the children. Now, we're lucky in Oregon that many of the staff will be vaccinated by the time that they are in a situation where they're having anything near a full classroom. But helping your staff mitigate will be your most high yield activity. So adults maintaining the 6-foot distance, think about staggered drop off and pickup. So parents tend to be adults too. Keep the adults outdoor when possible, discourage staff socialization outside of school. I know that's hard. I'm so lonely. Why do I spend my evening on school board meetings? I'm so lonely. I like to see you guys' faces. I hope some people are starting to smile there. Provide space for outdoor breaks, plexiglass barriers for adult separation. So these are some of the things that really can make a difference. Next slide, please. CDC, shortly after the AAP, put out some encouraging guidance, and these are some quotes that I put in here. Interestingly, more recently, the CDC has kind of pumped the brakes and been more cautious about advice to schools. Next slide. And the ABC School Network, these are 5 CDC school mitigation strategies, which are spot on. Next slide, please. But again, I think just last week, the new head of the CDC put some cautionary information out, and this is the response that just yesterday that ABC Science Collaborative put out, giving advice and sort of giving a context for the advice that CDC just put out with some important caveats. So I suggest that you read it. If you're reading the CDC stuff and you say, ooh, is it my imagination or is they not as encouraging as they were a month ago, read this I think it's a 33-page report. You may need a glass of wine to go with it. Next slide, please. And these next few slides are dashboards. I don't know what you guys are planning, but what the ABC Science Network and many places around the country talk about is transparency. Staff and families and community, they want to see what's happening in the schools. They want to see what kind of transmission is happening, how much quarantine is happening and whatnot. So these next few slides, Derek, you can just flip through them, are some different school districts. This one's Marin County. This is actually the school district where my niece goes to school in Wisconsin. You might have heard that toward the beginning of the Packer season, transmission of the virus, not in schools, but in bars and homes in Wisconsin, skyrocketed. The Packers were having a good season in the beginning. Again, you're supposed to be smiling now. Okay, never mind. My sister was really impressed. She's a lawyer and an MBA, and she really liked this. If you look at the next slide, you can see that when school started, they have this feature. Again, I don't know if you can see the top because of the way the slides are projecting, but they talk about the students being unavailable for education versus teachers. So those would be people who are infected or are out on quarantine. My sister told me in the beginning of the year, when they were just getting used to all the mitigation, there might be a day when 10 or 15% of kids were unavailable, quote unquote, because they were quarantined. But you can see how they're doing now. You know, they're down to less than 1% for their middle school, for teachers, 3.6 for Donjas Bay, which is, I think, where my niece went to elementary school for students. It's been very impressive. And around the country, people are saying that this kind of transparency on these dashboards is giving everyone a lot of comfort. Next slide, please. So finally, this is what y'all actually asked for. This is a little information about vaccines. So this is starting in December when Multnomah County started receiving vaccines. And you can see that on a daily basis, we've had increasingly more doses of vaccine delivered. So the lighter bar is the Pfizer vaccine, no, Moderna vaccine, and the darker is the Pfizer vaccine. And we've given 200,000 doses. So we're about 1/5 of the state's doses. We've given 1 million doses in the state of Oregon. Next slide. The title of this slide says Johnson & Johnson vaccine. Some of you have heard about this, and I'm just going to sort of call it out in case you feel like you need more information about it. It's a 1-dose vaccine. Is it possible in the future that people will get a booster? Sure, it's possible. Right now, it's 1 dose, and this is the efficacy you get on 1 dose. You get 85% protection against severe disease, and in the studies, no one died who got the vaccine from COVID. And I think those are pretty good numbers. And unlike the other 2 vaccines, this one was really studied at a time of very high disease case rates and the variants. So it was tested even in South Africa, and it was 80% protective against severe disease when they had a very high rate of their very dangerous variant. So would we love a 95% protective against any kind of symptomatic disease? Yes, but you cannot directly compare them. And I don't know if some of you have gotten the Moderna or the Pfizer vaccine. Boy, I felt terrible the day after getting my 2nd shot. And in the J&J vaccine, there seems to be definitely fewer sore arms and any of these other common reactions. So I personally am in favor of the J&J vaccine. I hope that people don't dismiss it because on just first blush, it looks less effective. There are good things about the J&J vaccine. Next slide. And this is what's happening with our testing and our positivity rates in Multnomah County overall. So you probably can't see my mouse. The blue lines, the blue bars are all the tests that are done in those weeks over the course of the pandemic. And the bottom, the sort of dark red bars are the positive. So those are the tests that were positive. And then the line that goes up and down and ranges between, 1.4 early on to 9.9 and now is drifting down, 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 down. That's the test we call percent positivity. So the percent of tests during any given week that is positive. So when that number was up at 10%, it meant there were a lot of sick people because only 10%, 10% of the people getting tested had a positive test. When there are fewer sick people around and more people who are not very ill are getting the test, the number is lower. So it's a pretty good indication of disease activity in the community. And you can see that ever since November, our numbers have been coming down precipitously. We have been very lucky. We have in Oregon, we have the 2nd lowest rate of death And I think right now we're second lowest overall in case rates. So we're doing amazingly well. So remember, as you look at this slide, remember kind of before the surge and after the summer, we were running about in the 2-ish% positive, now then up to 10% positive. And then I'd like to show the next slide. The next slide is the I'm going to show you zip code data in one little second, but our head epidemiologist, Russ Barlow, wanted me to remind you that zip code level data represents where a person lives. Does not necessarily show where the disease was acquired or where it is spreading. So you can't necessarily say that because a certain zip code has higher rates, that it means that people are picking it up in that same place. So you just have to be a little bit careful with zip code data. Okay, next slide. We are not allowed to share specific zip code data without a vetting process because it leads to discrimination and bias. So what we did here is we grabbed 4 zip codes that are, sort of your district or in the vicinity of your district. And what I wanted you to see is, remember when I was showing you in the fall that we were running in the 2 to 3% positivity? In your area, in these 4 zip codes around your school district, they were running 4 to 8% positive. And instead of peaking at 10, they peaked at 12.4. So there's always been a higher percent positivity in that part of East County. And I think there's a lot of reasons for that. I think part of it is that in people of color, early on, they did not have access to the testing. So in the very beginning, people were not tested unless they had a specific known exposure or they traveled to Asia. Well, probably the virus was around in East County easily 2 months before we knew of the first case in the United States at all. So we were already behind the 8 ball. And then so many people of color did not have the luxury of working from home. Like I have mostly worked from home since I left my hospital job. Those people were part of the essential worker group doing jobs that were not as protected as well as, for example, I was in the hospital. So I think that there's a lot of reasons why people of color have disproportionately been affected, and in your East County area, as well as the rest of the country. Next slide, please. So this slide shows hospitalization, and what we can see is that it peaked in kind of late November, early December, and has been really declining beautifully. But interestingly, if you can, you can spend some time with this by yourself, and you can see that there have been times in the pandemic when the white hospitalized population has been disproportionate compared to the fact that people of color have had the infection more and they have died disproportionately. So it's some very interesting data. Next slide. Derek, can you scoot this one up a little bit? This is some piece of information that you guys were interested in, so I'm hoping you can see this a little bit better.
This is Derek. I think that everyone can see the
okay.
slide deck just fine. I checked several.
Okay, I can't.
Okay.
Yeah, we can see it.
Oh, thanks. Oh, good. Thanks, guys. Yeah, I can't see the bottom of it. So what's happening here is that the pink bars are the total number of cases in the week, and the blue is BIPOC. So that's the term we use for Black, Indigenous, people of color, and then the orange is the white. And so you can see that during the peak of this epidemic, the BIPOC population in your East County area was very much disproportionately affected. My friends who did this epi stuff for me didn't have time to pull up population, so I'm not sure how that correlates with the population in that area. But I think it's very interesting that you can see that as our rates are coming down, that the discrepancy between those populations is also narrowing. And it looks real. It doesn't look like it's just because the numbers are coming down. So I'm very excited about that. And the next slide, please, also is very encouraging. So there have been times in this pandemic in Multnomah County, where the Latinx population might have been 20% positivity, or in the testing events that we've done for Multnomah County Health Department, there have been times when the Latinx were 40% positivity, just inordinate, which showed me a terrible burden of disease, but also a lack of access to testing. And now down to 3.7 last week is just amazing. A Slavic population is another group of people in East County in particular, because that's where a lot of people live, but everywhere else. But that number is markedly declining. Pacific Islanders have been the population that had the highest case rate, and their numbers have come down nicely. And I can't see the next one, but I think we talk about African American or Blacks who are also decreasing. So we're really, really excited about all the race and ethnicity groups that are seeing less burden of disease. Next slide, please. Y'all want to hear a little bit about variants. So viruses mutate. We know this. And before we even heard the term variants, we knew that mutations were happening. And some people who were using like this PCR molecular test to track how the mutations were happening, early on, they didn't identify that those changes were leading to more dangerous strains. But starting in the UK and then at South Africa, Brazil, we learned that some of these strains were mostly easier to spread, but sometimes more dangerous. Now, Oregon is just starting to systematically look for those variants. And we could talk a lot about this, but just in the UK, they were lucky because they had a certain PCR test that picked it up a bit by accident. Again, I could talk about that a different time, but I'll run out of time. So we're starting to do more to look for those variants. There's a collaborative effort between OHSU, our Multnomah County Health Department, and the state lab. They applied for a CDC grant, so we could do really good coordination and learn a lot about that. You may have heard that the vaccine companies, so Pfizer, Moderna, J&J, AstraZeneca, you know, there's scores of drug companies that are making or have made vaccines. Those drug companies are already working on new vaccines in case we need a booster shot that does a better job against these variants. So even though I'm worried about it, sure, you know, I'm a pediatrician, I'm a mom, I worry about things, but I think we're in good shape right there. Next slide, please. And then finally, this is just one slide I put together on testing because someone had mentioned that. I think the important thing to know about testing is that the tests are very different and they look at different things. So the PCR test can stay positive for weeks. It's very sensitive, but it doesn't always tell you if it's positive. It doesn't tell you that that person is contagious. I know not everybody's in love with these antigen tests, but I really like them because I think that if you're using them in the right context, they really kind of tell you who's contagious, and they only take 15 minutes. If I don't learn for 2 or 3 days who potentially could have exposed my classroom 3 days ago to 5 days ago, I've lost a lot of opportunity. But if I know in 15 minutes, I can get a lot more information that's going to be operationable. So I like the antigen test. And I think the next is the last slide that I prepared. Next slide, please. And it's a pep talk. Go team. You're gonna do what every school who's gone back in person to do, which is learn how to get everyone on board with the mitigation, and you're going to keep everyone safe as humanly possible. And the Multnomah County Health Department, we're your team. We will support you in these efforts to keep everyone safe. You will have cases. You'll even have transmission, and we're going to be here to help you when that happens.